Thank you very much to Canada Health Infoway for the opportunity to speak. It's great to be with you today, with everybody in the room and all the folks who are watching on the webcast. Je suis heureux d'être ici à Montréal, sur le territoire.
I'm happy to be with you on the non-ceded traditional territory of the Caughnawaga to participate in the launch of this conference today. I'm quite happy to see that so many of you will be spending the next 2 days exploring the ways to use digital solutions to improve access to care in Canada. We have very good reasons to be optimistic, but there's still a lot to be done.
There is a lot to be optimistic about in terms of care delivery in this country, but we have a lot of work left to do. And I want to spend a couple of minutes today talking to you about my perspective and Health Canada's perspective on this issue. Investments to date by FPT governments have put in place the core digital infrastructure for Canada's health systems. If you look at sort of some of the top-line statistics, they don't look that bad. Electronic health records at various stages of maturity all across Canada. 85% of primary care physicians now using electronic medical records. But, and you all know these statistics as well, our systems are not as interconnected as hoped, and patients don't really experience all the benefits of digital health. For example, in 2017, only 15% of adult patients had access to their medical records electronically in this country. And this year, only 10% of Canadians report being able to consult with their healthcare provider through email or online. Some jurisdictions have made significant advances in the availability of telehealth, but in other parts of the country, it's still in pilot phase. We're going to hear a lot at this conference from innovators and how we can accelerate change. As the Deputy Minister of Health Canada, I come at digital health from several perspectives. From a regulatory and policy perspective, as a funder of Canada Health Infoway, as a member of the Federal, Provincial, Territorial Conference of Deputy Ministers, and as a participant in a range of international discussions about the future of health. Rather than focus in on specific innovations, I'd like to use my remarks today to help frame the conversation from a broader perspective and talk a little bit about how we see digital health from the various hats that I just mentioned, regulatory, funder, and so on. Canada has done many things right in healthcare. We have a single-payer public system based on need and not ability to pay, and that's something. We have highly talented healthcare providers. We have some of the best hospitals and research institutions in the world. Yet, Canada does not have high-performing healthcare systems. I'm going to be in Washington later this week for the annual meeting of the Commonwealth Fund. Many of you are well familiar with the various studies they have done. Canada has fallen progressively down the league tables with each study done by the Commonwealth Fund every year. We're not quite dead last, but we're kind of a runner-up for that prize, notwithstanding that we spend among the middle of OECD jurisdictions. So sort of my brief to governments when they ask about healthcare, we're a relatively high spender with relatively middling results. And why is that? Well, many pieces within our system function well on their own, but they don't work very well together. They weren't designed to, they're not funded to do that, they haven't been asked to do that until very recently. And you see that in the statistics. How easy is it to get care after hours without going to the emergency room? We're almost dead last when that question is asked of healthcare systems around the world. How easy is it to get care over your smartphone or on the internet? Again, we do very poorly in that score. With an aging population, increasing rates of chronic disease, and cost pressures tied to new drugs and technologies, our systems must transform and adapt if they're to deliver better care and better outcomes at a cost that is affordable to taxpayers. Le passage au numérique n'est pas une fin.
The move to the digital world is not an end in itself. We're quite aware this solution cannot solve everything. In fact, we know that it's not the answer to all problems, but it can lead to a change in some sectors and speed up the change in some others.
The fix for everything, we know that. In fact, it's not the fix to many things, but it is a powerful tool to drive change in some areas and to accelerate change in others. Digital health solutions can help address one of the most persistent challenges facing our healthcare system, improving patient access to care. We see at Health Canada, I have to say, investment in digital. We talk a lot about change and transformation in the healthcare system. This is a very difficult challenge for governments. And it's been a very difficult challenge for governments in this country for a very long time. Spending in healthcare, as you know, is one of the largest line items in any provincial or territorial budget. We have, various parts of the system that have been in place for many years. Making change is very difficult. Investing in digital, I see a little bit the way the Internet has led to bottom-up change throughout the economy. If you think about the interconnectedness that has been delivered by the Internet, it has transformed, the travel industry. It's transformed, manufacturing. We have the opportunity to use digital and IT as a transformational tool, not just, kind of from a top-down perspective with governments making investments, but as a way to drive change from the bottom up. So let me give you an example, a couple of examples of the kinds of things that are happening as a result of digital access to care. Saskatchewan has an e-consultation pilot which found that 50% of remote consultations between specialists and primary care providers lead to an avoided referral. That saves precious time and resources for both the patient and the healthcare system. Ontario's telemedicine network allows Ontarians with COPD and congestive heart failure to use virtual tools to reach their doctor, and their e-visits program is supporting 1,700 specialists to do remote visits with patients through local health centers. Au Québec, le tout nouvel service.
In Quebec, the new Carnet de Santé system that you'll be hearing about more later this morning offers now a series of services, including taking appointments online with your family physician.
Participating doctors said sharing of information online is valuable, and 85% of patients said access to results online made a positive difference in managing their health. And 226 First Nations across 10 provinces and territories will be able to access a comprehensive personal health record designed by and for First Nations citizens to share information inside and outside of First Nations communities through the Mustimuk Citizen Portal. However, notwithstanding all of these great examples, the obstacles to scaling up digital health are formidable. This isn't an easy task, or it would have been done by now. There's a need to balance the capital and operating costs of new technology with the reality that anticipated benefits and savings are largely realized over time. There's a lack of consistency in standards and implementation standards in particular across multiple health information systems, as well as privacy protection requirements, and these continue to make it difficult to achieve interoperability. Privacy protection is absolutely central in healthcare, but I personally actually have experienced some of the challenges with the federal government working with provincial governments to deliver better care for First Nations in the north. We have many facilities in northern Canada where we have provincial doctors working alongside nurses that are paid by the federal government, in the past through the First Nations and Inuit Health Branch of Health Canada, and today through Indigenous Services Canada. It took a lot of work between ourselves and the province to be in a position where we could actually share information inside the same clinic digitally. So, this is just an example of some of the challenges that we face. Les médecins cliniciens ont besoin de soutien.
Physicians need digital support and need to change towards a digital environment, as well as compensation models that encourage adoption of these technologies.
Physicians aren't using them because the remuneration models don't work. That will be a big problem. And all of the challenges I've just mentioned, new remuneration models, privacy, how to get decisions on very expensive systems when the benefits are long-term, that's for the technologies we know about. And the reality is we can't even begin to know all the ways digital technologies are going to disrupt the status quo. What we've seen so far in healthcare is only a small sliver of the disruptive innovations that are taking place in other sectors. Technologies once thought beyond the realm of possibility are likely in our lifetime. Think of iPhones, AI, machine learning, self-driving cars. I have to tell you, I spent most of my career in economic ministries, transport, agriculture, trade. Health is really, in Ottawa terms, the first social ministry that I've worked in. I found that very amusing when I came to Health Canada. I've been here in the organization 4 years now. All of the same pressures of globalization, technology, cycle time compression, all of the things that everyone worries about in the rest of the economy, they're coming down full force in the healthcare sector. And we as a regulator are spending a lot of time figuring out how we're going to deal with all of these trends. So, the changing world is affecting health at least as much as the rest of the economy, and we need to be ready for it. And I could go on. Blockchain, augmented reality, neurotechnologies, all of these have tremendous potential both for healthcare systems and for broader society. Faced with this exponential pace of progress, it really is impossible to predict exactly what the impact will be in the future. It is unrealistic to think that the traditional players will be able to address obstacles using the usual incremental approach. Now, there are a number of other sources of change in the healthcare system we also have to be ready for. First of all, patients are getting impatient. They are increasingly comfortable with digital technology in all aspects of their lives, and they want healthcare systems to keep pace. Here's some recent survey data from Ipsos. 3 of 4 Canadians believe new technologies can fix healthcare system problems. 7 in 10 would like to take advantage of virtual physician visits. 6 in 10 would wear a mobile device that monitors their health continuously. Patients are increasingly active in creating health innovations of their own. They're not waiting around for us. Patient health hackers, for example, involved in #WeAreNotWaiting, a project to create that project created an artificial pancreas system for diabetics when the private sector didn't follow through fast enough. There are patient-led solutions like the Haleo Healthy Sleep Program. It's an app that tracks sleep behavior and mental health. We have a U.S. teen who was reported in the press, printed his own braces, 3D braces for $60. And I was just reading the paper the other day. There's a bit of a concern in the orthodontic world because people are now ordering, their Invisalign braces online, and, they're taking a photo of their mouth and they're mailing it into a service provider that might be on the other side of the country. I have to say, as a regulator, we are dealing with all of these challenges. There's a rush of new technology, and frankly, there are enormous expectations of the citizens that we're accountable to around how we're going to regulate, what we're going to do. Just in the 4 years I've been at Health Canada, the expectations on us to explain to the public, to explain to the press what it is we're doing and why, have gone up astronomically. In fact, I would argue we're more open now and more transparent. We report on most of our inspections, of the various letters we send companies. All of those things are increasingly being required to be made public because people are demanding to know what's going on. So where does this all take us? These developments raise questions that even a few years ago weren't really on our radar. With more tools and apps accessed and managed by patients, and with more diagnostic data generated by patients, patients will have more control than ever over their health. That raises challenging issues for health policy. When should governments, healthcare providers, and regulators act as intermediaries to patient care, and when should they not? What does it mean for the funding models and built-in gatekeeping functions of our current healthcare system? When there are millions and likely one day billions of possible data points available, which ones do patients and providers trust to inform their care decision? What will the implications be for provider liability? And what will that mean for what patients and providers need by way of health literacy training? How do we support equity of access to these tools so that vulnerable populations aren't left even further behind? Governments need to figure out how to set the conditions for success regardless of what's coming down the pipe or how the pipe is built, making sure that what is available to the public is safe and that up-to-date and reliable infrastructure underpins new technology, protecting societal values like the privacy of personal information while supporting innovation and allowing innovative ideas and technologies to flourish, and making sure all of this doesn't break the bank. How do governments decide when there is enough added value in patient outcome improvements to justify the cost to taxpayers? Les gouvernements provinciaux et territoriaux, de même que les intervenants du système de santé, s'emploient déjà à trouver des réponses.
The healthcare system is already trying to find answers to these questions and see how they can increase their capacity to react to innovations in digital healthcare.
With our colleagues in the provinces, but federally we're doing several things. First of all, we're investing heavily. We have invested heavily, and we continue to invest over the past 2 decades in digital health through Canada Health Infoway. And continuing to invest in Infoway brings tangible benefits to Canadians. We're also changing the way in which we invest, and we've asked Michael Green and the management team at Canada Health Infoway to sort of move in new directions. We're moving away from a model that I would, if I was being a bit simplistic, just tended to cost share whatever project a jurisdiction wanted to proceed with, towards trying to be more strategic, focusing on interoperability, focusing on national platforms, focusing on projects that are pan-Canadian, trying to tie the various parts of the system together. Infoway's national e-prescribing service, Prescribe IT, will increase convenience for patients and improve the analytical capacity of jurisdictions across the country while reducing medication-related errors, prescription fraud, and the potential to abuse prescriptions. So Prescribe IT is a great example of the direction we want to go in. L'initiative Access Atlantique, une collaboration entre
Access Atlantic, collaboration between Infoway and the Atlantic provinces, will manage information, broaden citizens' access to their own health care.
Example of sort of the new directions that we've asked Infoway to go in, a kind of a regional model, multiple jurisdictions all working on the same platform. You'll hear a bit more about the new Infoway-led Access 2022 being launched at the conference. A joint effort between Infoway, innovators, e-service providers, provinces, territories, healthcare professionals and organizations, and patients. It aims to modernize how healthcare providers and patients engage with the healthcare system. For example, working to accelerate the spread of patient portals, e-prescribing, and e-visits. So, support for Infoway and support for digital kind of expansion, that's one way the federal government provides support. The second is we have been working with the health and bioscience industry to look at ways that we can better support the health and bioscience sector as an industry, as a Canadian industry. The Minister of Innovation, Science and Economic Development, the Honourable Navdeep Bain, set up what's called the Health and Biosciences Economic Strategy Table. I'm the member of the table, the Health Canada representative, the government representative from the health sector. And that table is comprised of CEOs from a variety of different disciplines in the health and bioscience sector. And it was asked to look at a new model for support to the sector. And it produced a report, which is now available online. And I have to tell you, there were some really interesting conversations at the health and bioscience table around why it is that so many of our firms do so well in other jurisdictions but have a really hard time selling into the Canadian healthcare system. And it was a good deal of discussion about the fact that our system is actually quite stovepiped and of the value that tying together the various parts of the system could bring, making it much easier to pay for outcomes, measure value in terms of interventions. For that reason, in September, the HBEST, Health and Biosciences Strategy Table, we call it the HBEST Table, its report highlighted the need for a nationally robust, digitalized, interconnected, and patient-centered health data infrastructure that would open the door to new possibilities in patient-centered information and digital services, AI, big data analytics, and disruptive digital technology. The report is really worth a read. It talks about, not only if we're to have a better healthcare system, but if we're actually going to take advantage of the significant economic spend that we do, that a digital infrastructure is actually a kind of a precondition for success. We're also working to ensure that our regulatory system is supportive of the direction the healthcare system needs to go. Health Canada has been increasing its capacity to respond to faster innovation cycles and to better support the review of digital health technology. This is part of a broader change that we are making in how we regulate, in particular, drugs and medical devices. It has a cute nickname, the R2D2 Initiative, the Regulatory Review of Drugs and Devices. This is backed by more than $70 million of funding. We have a major project office. We have hired many new staff, specifically to look at basically rebuilding how we regulate drugs and devices more or less from the ground up, to account for all of the change I've talked about: faster cycle times, biologic and genetic therapies, precision medicine, AI, big data analytics. We're actually seeing that in the products that companies are bringing to us to approve now. And this is something we really have to get ahead of if we want to not just enable patient access to these therapies, but actually regulate responsibly for the health and safety of Canadians. Let me just give you one example. Medical devices that rely on software and can be connected, either through Wi-Fi or Bluetooth, but can actually be connected wirelessly. If a cyber security issue is discovered, it needs to be patched quickly. I mean, particularly if you have an implantable device that you're relying on, as a life or death matter. Well, the way we have traditionally reviewed medical devices is, you send us your proposal or you send us, your package. We take our time to kind of, review it, make sure it's all okay, and then we give you an approval. And there's nothing particularly wrong with that. It's just you don't want to take 6 to 8 weeks or longer if you actually have a cyber vulnerability that is now publicly known to update the software that runs your implantable medical device. So we actually need to be able to respond much faster, in some cases in real time, to developments that are out there in the real world. So we have a new digital health review division that will focus on the regulatory review of technologies such as wireless medical devices, medical apps, telemedicine, and artificial intelligence. And companies that come to us that want to talk about these things, we are quite eager to engage with them because we want to know what's happening at the leading edge. We have a new scientific advisory committee on digital health technologies that was created within Health Canada to address issues such as cybersecurity and artificial intelligence. And we're also going to be co-chairing an international working group on medical device cybersecurity with the U.S. Food and Drug Administration. So on the regulatory front, there's a lot we're doing to try to get ahead of the kind of developments you'll be talking about at this conference. We're also working on trying to have better strategies around data collection, data management, use of data. There are significant risks related to big data, especially in the context of the growth in patient information databases and the potential for related profits with those who have bad intent. Last month, the Canadian Institute for Health Information hosted its first privacy symposium, bringing together governments, health data organizations, privacy commissioners, researchers, and the private sector with an interest in supporting broader access to health data in a privacy-sensitive manner. This is something that we at Health Canada are very interested in. Obviously, we need very strong privacy protections. Obviously, we need very strong cybersecurity. But we need to find a way to do that collectively as a system so that patients can reap the benefits. L'Institut pour l'Information en Santé est aussi engagé.
We've also committed to pursue the work with its partners to find practical applications to reach this goal. According to the recommendations made by the OECD 2017 meeting of health ministers, to encourage or foster greater access to health care information, to improve care, and to make the system more efficient.
In Canada, but with the OECD. More broadly, the Government of Canada writ large, of which obviously Health Canada is just one part, is developing a whole-of-government data strategy, an approach to creating, protecting, using, managing, and sharing data as a strategic asset, with a goal of enabling informed decisions that lead to better outcomes and services for Canadians. We're also trying to take steps to deal with the issue of cybersecurity. Canada's National Cybersecurity Strategy, released earlier this year, focuses broadly on the need to develop partnerships with industry, provinces, and territories to create a national plan on cyber incidents and protect the integrity of Canadians' data, including in the health sector. It builds on the ongoing work between governments and health system stakeholders, including Healthcare Canada and Infoway, to develop cybersecurity best practices for healthcare settings, increase resilience to cyber threats, and educate health organizations and professionals about risks and mitigation strategies. Past experience exists on which to draw as we collectively move to harness the revolutionary potential of digital health innovation. Patient care needs to be the defining framework for digital health. Access, integration, and quality need to drive changes. The goal can't be digitization for its own sake. Cost imperatives need to be front and center. They won't disappear for governments. The private sector and patients need to be engaged in thoughtful conversations about that. Digital health change won't be free, and despite promise, we know from experience that cost-saving dividends are hard to harness from the healthcare system. Furthermore, the upfront costs of adopting new technologies can be considerable. We need to really understand how changes as a result of digital disruptions can and should be funded and by whom. Innovations, digital or other, need to be designed to be spread if they are to be successful. And there will be a need to have controls on the adoption of new technologies that some people may or may not like, but governments have a stewardship role and an appropriate balance is needed: cybersecurity, privacy, access, etc. So, in conclusion, I'd like to encourage you to spend time during the conference thinking of what needs to be done to make the digital transformation that is coming work. How do we, in whatever our role, support innovators to keep the good ideas coming? How do we harness the best ideas and put them in service of broader system transformation? Comment pouvons-nous assurer que les patients jouent?
How can we ensure that patients have a bigger role to play in this quickly evolving system in order that their voices should be heard and that digital healthcare technologies that we adopt fix important problems?
How do we provide Canadians with comfort about what is available on the market or in healthcare systems and how it impacts their health and their privacy? How do we strike the right balance between what governments and insurers adopt, implement, and pay for and what they don't? How do we make sure we are really driving improvements in access to quality care and better patient outcomes and not just adding in interesting but ultimately adding things that are interesting but ultimately not very productive. Gatherings like this are a great way to advance the conversation. I hope I've given you a little bit of a sense of the things that we are worrying about up in Ottawa. We look forward to working with all of you in the months and years ahead as we build a better healthcare system for all Canadians. Merci beaucoup.